Memorial Day, when the US pays tribute to its war dead. But this year, those who have succumbed to COVID-19 are also being mourned. More Americans have died from this disease than in the Korean and Vietnam wars combined. 3 months ago, there was no recorded deaths in the US. Now it has the highest death toll in the world. How did we get here?
Late last night, I had a very good talk with President Xi, and we talked mostly about the coronavirus. They're working really hard, and I think they're doing a very professional job.
Impressed by China's response to the novel coronavirus in January and February, perhaps the US president was lulled into a false sense of security, despite warnings from the WHO that COVID-19 was already spreading in Asia and beyond.
I said, actually, I asked the various doctors, I said, is this just like flu?
There were also warnings in January and February from US health officials and close advisors to the president. The US also lost time by deciding not to use the WHO diagnostic test. The US test had fundamental flaws and was delayed by weeks. And although the US president imposed a partial travel ban, first on China and then on some European countries, it was essentially too late. New York had already imported many cases from Europe, but US scientists traced Washington State's first case to China. Community spread was already happening, and tens of thousands of US citizens returned in a rush. Long lines and little screening led to another spread of infection. As cases climbed in Washington State and New York, the White House delayed issuing a stay-at-home order. State governors acted first. Valuable time had been lost. One recent study suggests 36,000 lives could have been saved had the US acted just a week earlier. Then, in mid-March, as hospitalizations and deaths accelerated, the US suffered severe shortages of medical masks, gowns, and life-saving ventilators. Lack of planning meant imports were now difficult to get, and US manufacturing would take months to start ramping up production. A procurement war between the federal government and the states also led to confusion and delay. Political infighting slowed cooperation too.
I am not engaging the president in politics. My only goal is to engage the president in partnership.
The US coronavirus task force had problems too. Modeling based on optimistic social distancing assumptions predicted deaths below 60,000. But as the disease continued to spread, reality overtook statistical models. The coronavirus daily briefings were also co-opted by the president, who sometimes spread false optimism and sometimes dangerous theories on potential treatments.
And then I see the disinfectant, where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning?
And as the US economy was essentially shut down, the US president quickly set his sights on an early reopening, first declaring Easter as a suitable date, but then reality intervened once more and the stay-in-place order was extended. But the US president pressured states, especially ones led by political rivals like Michigan, to open up. Small but vocal demonstrations against shutdowns were supported by the US president. In this political climate, many states began to reopen their economies against the White House's own guidelines.
My concern is that we will start to see little spikes that might turn into outbreaks.